speak about the presentation. So my name is Eduardo Di Mate, and remember that in this case I'm exposed to the organizational climate and burnout in the health sector and scoping review. This is the principal author and the other authors. In this case, Morales, Juliet, Pachon, Maria Alejandra, Sierra, Anibelena, and Eduardo Di Mate. So, continue with this problematic. So, the scope review show the burnout is commonly in the workplace and related to various factors such as organizational climate, which affect workers and mental health. So, the problem statement to the organizational climate can be understood as a set characteristic that describe an organization and include employee behavior, referring especially to how workers perceive and interpret their work environments. Moharami et al. 2019. And the healthcare sector burnout syndrome is the workplace and it composed the two dimensions, emotional exhaustion and despersonalization and reduced personal accomplishment. So burnout syndrome was first clinically described about 60 years age ago. It is considered an occupational disease that has negative effect on the work and on their overall performance within the workplace by Bautista Diaz and Bravo, Saavedra 2016. So this is a principal concept for to make this equation. First question is what is a relationship between organizational climate and burnout in the healthcare sector according to the exit literature? And the general objective or aim is to determine the association between organizational climate and burnout in the health sector in light of the existing literature. So the methodology is a product post-positivism research approach. Quantitative and descriptive is a research design and scoping review type of the study. The scoping review was conducted follow the PCC strategy or framework the databases Science Direct, Scopus, PubMed, and ProQuest were researched, focusing on the study related to the organizational climate and burnout in the health sector. Finally, 18 articles that meet the selection criteria and the CAS quality assessment were included, identifying cross-sectional and cohorted study. So this is a methodology uh, uh, that we was used at the PSC, in this case, P, healthcare professional, for example, and healthcare professional, and C, organizational climate, with the respective mesh decks and free terms. And this is an algorithm in the PubMed Scopus Science Direct ProQuest database. So the C node is other component to the PCC strategy. So with respect to result or outcomes, in response to the research question, and research was conducted in databases such as Science Direct, PubMed, Scopus, and ProQuest using the mesh index terms applying to the volume operator and or they construct the research algorithms. In this case, this is a table with respect at these search terms and databases. So the flow diagram of article research and selection is possible that it will be with, in this case, each database is identified in this flow diagram, identification around to the 9284 articles, eligible only 25 and included only 8 articles. Study deployed in the scope review, 8 articles. So with respect to results, is necessary that as planning will speak about the quality analysis. In this quality assessment, using the CAS critical operational skill programming checklist, 6 articles meet 200% of the criteria. On the meet 99.9%, on the meet 71.4%. So, of the articles publications, around to the 40% were from 2024 and 2023. 25% were from 2020, one article from 2013 representing 30%, and two articles from 2008 times 2005 accounted for 25%. The average number of the author across into the eight article was 5.13 among the 41 authors identified. 2020 were 22, sorry, were women and um, 19 were men. Headman, according to the country of population per article, the principal countries are United States with and three article. This is an impact factor. So, continuing with the result, it's possible that you be with the performance indicator, the article with the highest number of citation in Scholar, Google Scholar was Georgi et al. 2016 with a total of 270 citation, while the article with the lowest number of citation was Al-Arak et al. 2024 with zero citation. It's possible that you identify this tendency or trend in this imaging. So the other typification with respect to the variable is organizational climate, burnout, medical results, and nursing results. It's possible that we would earn all outcomes. So, okay, and focus to the discussion. In this scope review, the relationship was identified between moral distress score and burnout with a median difference of 47 times 88.1, like hypothesis proof, minor to the 1%, and Calaf et al. 2023 reporting a median level of radio of 6.92 between as an interval confidence of the 95%, between as 2 more or less 20, and the high level of radio is of or are 16 around with the confidence interval 5 between us and 15, and it was identified that the presence of the moral distress is more prevalent among physicians that among nurses and social workers. Similarly, the moral distress score reported for healthcare personnel were described to the Tsukamoto et al. 2021 and Yori et al. 2016 state that organizational climate does not or doesn't directly affect health, but rated does so through workplace bullying and burnout. Likewise, this factor should be measured simultaneously. And the other way, Arad et al. 2024, like a highlight that foresting and a positive organizational climate creates a safe work environment that reduces stress and increases job satisfaction, thereby mitigating burnout among professionals. Their structural equation model result report of the value of 0.627, which hypothesis proof minor to 1%. So, in conclusion, scope review indicated that the majority of the population represented in the analysis article consists of women, work, and healthcare professionals. In the research process, 25 articles were identified based on the inclusion and exclusion criteria, resulting in 16 eligible articles, and quality assessment was conducted using the CAS checklist, leading to a final selection of the 8 articles included in the study, sorry, and the relationship between organizational climate and burnout in the healthcare sector was clearly identified, showing the deficiency and the organizational climate directly affect the health and well-being of professionals, increasing the likelihood of developing burnout. For the last sentence, the various finding highlight the importance of evaluating, monitoring, and controlling the organizational climate in the sector in order to limit the risk of the manifestation of burnout syndrome among healthcare professionals. Okay, and the reference is possible that you identify the reference. Only use your. It's possible that you use your smartphone and the camera, and this is the contact if you has a question with respect to this position, and no more. Thank you for all and only have a good time.